Can I start my remarks tonight by paying tribute to Baroness Kinnock, who many people in the room will have known. Her family, of course, said that she faced her Alzheimer's diagnosis with innate courage, and I'd like to thank them for speaking publicly about what she went through and raising awareness of the disease. I can't think of anywhere better and anywhere more important than to be making this one of my first speeches as a Minister for Health in the Health Department and Social Care Department. And can I thank the organisers for inviting me. I hope my presence here tonight will be taken as a sincere gesture of the government's support for all the work being done by people in the room, because words alone cannot express how grateful we are to charities like those represented here tonight. Alzheimer's UK, Dementia UK, the Brain Charity, Dementia Concern, Dementia Carers Count, and so many others do so much outstanding, life-changing work. I've been proud to support a range of Alzheimer's support groups across my constituency of Pendle, up in Lancashire, where I've seen the fantastic work of those charities firsthand. We value the partnerships we have. We value your advice, and we value the way you push us to be the best that we can. I also want to pay tribute to the dementia service champions across our NHS who make thousands of lives better day in, day out. And finally, and most importantly, to the unpaid carers, the unsung heroes who so often devote their lives to caring for someone with dementia. Young and old, rich and poor, urban and rural, from all walks of life, close to 1 million people in England are living with dementia today. Each face their own challenges, but dementia is not a death sentence, and people living with dementia are not a burden. They are human and they are precious. It falls upon us to continue treating them as such and to never talk about them as if they weren't in the same room. And my promise to you today, as I begin my journey as a new health minister, is to never forget this guiding principle. In all matters of policy, individuals must receive dignity, and that is very personal for me too, because as Ben said in his introduction about his grandparents, my maternal grandmother, Mary, suffered from dementia, vascular dementia, brought on by a series of strokes. I remember going to visit her in Manchester Withington Hospital, and I remember the locks on the doors for the patient's own safety. I watched as my grandmother, the grandmother I knew and loved, I watched her slip away from us. Sadly, I know my own family story is far from unique. The other day I read about Marion Ritchie. Her husband David served in the Royal Navy in his younger years. At 65, like thousands of others, he was diagnosed with dementia. And then for 10 years, he slowly slipped away until he could no longer recognise her or their 2 daughters. What a tragedy that that man, who must have had so many treasured memories from his seafaring days, could no longer share them with his loved ones. Marion spoke about her pre-death grief, meaning she felt she had already lost her husband before he passed away. In a way, dementia robs people of their sense of self. It is a cruel foe. Unpaid carers like Marion deserve a government that's behind them every step of the way. That's why we made sure the Health and Social Care Act included provisions for integrated care boards to involve patients and their carers in all decision-making over their care and treatment. The Care Quality Commission has a new duty to assess how well local authorities are delivering adult social care, including how well they are meeting the needs of unpaid carers, making sure they have more choice and more control. And in October, we launched the Accelerating Reform Fund to support innovation in social care by looking at innovation projects on the ground and scaling them up across the country. The fund includes our commitment to invest up to an additional £25 million to support unpaid carers, specifically supporting projects that will make their lives easier. It's the right thing to do, and I know many of you in the audience today have called for a more person-centred care in our policy making. That's why we're putting it front and centre in our major condition strategy, which we aim to publish early next year. The strategy will be informed by your lived experience. People in local government, the voluntary sector and the wider industry. As a minister, I will always make sure that your voices are heard. And if you contribute to our call for evidence, I would like to thank you from the bottom of my heart. I know, as you do, the pandemic has cruelly reversed some of the hard-won progress that we've made over the past decade. But the NHS is looking to claw back some of that progress, piloting a diagnostic advanced dementia mandate tool in 14 care homes, and the initial feedback from that has been positive. And to you, the researchers who are striving for solutions, I want to back you in your battle to defeat dementia. As Lord Cameron, now back in government, a fierce campaigner to improve the lives of people living with dementia, said 10 years ago, dementia is not just part of ageing, it's caused by diseases, and diseases can be defeated. Just a week after World AIDS Day, we should remember how far we've come in the past 40 years. Today, people living with AIDS have a similar life expectancy to the general population. And in this hall, adjacent to where we are today, in the Great Abbey, how can we not reflect upon the final resting place of Hawkins, Newton, or Darwin? These great men and women never accepted the status quo. And when it comes to defeating dementia, neither will we. Our focus in government is giving the great men and women of today the tools they need to finish the job. Last week, I visited the UK Dementia Research Institute based at Imperial College, London. I was moved by the hard work, the dedication and the expertise of those scientists and their transformative efforts to improve the lives of those living with dementia. Since 2010, with their help and yours, we've made good progress in the rates of diagnostics. From just over a third then to just under 2/3 today, we're on track to deliver a manifesto commitment to double dementia research spending by 2025. And last year, the Prime Minister launched the Dame Barbara Windsor Dementia Mission, backed by almost £100 million of government funding. And of course, clinical trials are absolutely key, as James O'Shaughnessy may talk about shortly. In the autumn statement, the Chancellor announced up to £20 million of funding to launch a clinical trial delivery accelerator focused on dementia. I'm also pleased that the government-funded National Institute for Health and Care Research has launched a number of initiatives to support new dementia research, including £11 million to develop new digital approaches for early detection and diagnosis. The £9 million via the NIHR Research Schools and the new Dementia Policy Research Unit, so our policy making is informed by the latest evidence. These initiatives will focus on new treatments for dementia, improve the quality of life for people living with dementia, and help government make the right decisions when it comes to their carers. These efforts will complement yours as we struggle side by side to deliver for people living with dementia and their carers. I'd like to end by thanking you all for your resilience, your determination and your tireless work to improve the lives of people living with dementia and those who care for them. My focus will be unrelenting in standing up for the carers, the scientists and the charities as we work together to defeat this disease. Thank you.
I do want to start with a thank you, actually, not just to you, Ben, indeed all the speakers who have explained to us, not that we needed explaining, both the human cost but also the extraordinary opportunity that we have in front of you. I want to thank all the dementia patients, the carers, the champions, the charities, the companies, NHS workers, clinicians frontline, and those in the background, all of whom have been working tirelessly to try and achieve that aim, which you said, Elliot, of making the UK the best place to grow old with dementia in the world. And I think if I reflect on what we have achieved in the Commission, and I'm going to talk a bit about that in a moment, I think it would not have been possible without actually decades of work that have happened in this area, not just in the areas that I know about in clinical trials and research with the Dementia Mission, but in policy, in the carers strategy Margaret, that you did so much to argue for, and the work that the APPG has been promoting for so long about better care. And I think if anything, we've just got our timing right, because we are now riding on a wave of the possibility of disease-modifying therapies, an opportunity, a genuine opportunity for hope that has been denied for so many people over so many years. So it's been a great privilege and a great thrill to carry out this commission. I'm deeply grateful to my co-chair, Professor Mike Buick, who is there with us, to the other members of the commission, to our partners, to the Alzheimer's Society, to Lilly, to Roche, to Viewit, to Egg Insight as well, and to everybody who has contributed to what I hope will be a signal piece of work that will stand the test of time. When we were starting this review, I think, like everybody, we're so excited about what's coming through the therapeutic pipeline. And all of you who are involved in policy know when something exciting happens, you get two sort of contradictory thoughts. On the one hand, it's, oh my God, it's all going to change, this is going to be great. And then the other thought is, oh my God, it's all got to change. What the hell are we going to do? And so hopefully, if nothing else, this contribution is this report is a contribution to the what the hell are we going to do? Because clearly, our view as a result of carrying out this work is that everything needs to change to take advantage of these opportunities. How we diagnose, how we care, how we interact with carers, patients and their families, pathways, not just one dementia, many dementias, personalised medicines, innovative funding models. There's almost nothing that doesn't need to change. And of course, that can happen in a piecemeal way, or it can happen not at all. Or it can happen in a holistic, comprehensive way, which, as we've heard already from all our speakers, which everyone wants to get behind, which nobody sees an ideological or partisan advantage in, but purely sees the opportunity to change people's lives for the better, both those who have dementia and, of course, everybody who is affected by it. We've all got personal stories. I'm no different. And of course, it's that emotion that gets you through the difficult times. But what we've hopefully also been able to apply is the collected brain power of everybody in this room and many, many other people to come up with a set of solutions for how we should do things differently for those 1 in 3 people who are going to be diagnosed with dementia at some point in their life. We've set out in the report what we describe as a vision for dementia care, one based around accurate diagnostics, therapeutic choices, personalised care, an holistic approach and a supportive environment. We've talked about how we can bring about a new paradigm of care, which I'm going to give you the sort of top 10 takeaways for that in a minute. We've also thought about delivery. And there's a tendency in the sort of health and care world to think a lot about structures of things. And sometimes we get sort of distracted by thinking about how we can reorganize things. But we actually have a structure now in the health and care system, integrated care systems, which could not be designed better to deliver against this task, which covers all aspects of caring, all aspects of health, preventative all the way back to acute and palliative at the end. So this is a problem set tailor-made for integrated care systems. And I really think, as well as the national level policy, and of course it's different in Scotland, Wales and Northern Ireland, but in England at any rate, integrated care systems are going to be at the heart, I hope, of delivering a better future for dementia care. So what did we recommend? First of all, we talked about enhancing early detection and prevention. There are clearly a suite of existing technologies that we need to rapidly expand, as well as discovering new ones. We need to strengthen timely diagnosis. That word timely came over. What's the point of having a diagnosis if you can't do anything about it? Well, now we can. So let's make sure that we get to people at the right time, that we can actually help them change their lives, delay the onset of disease, or indeed, in some cases, of course, completely avoid it altogether. We need to transform those dementia care pathways that I talked about. It is not just one word, one condition, many conditions that are going to need to have their own specific design around them. We think there should be a task force to think about how we can design the workforce that we need in order to deliver that. Clearly, we also need much greater support for carers, for families, to put them front and centre, to use those digital channels that you were talking about that actually give people real control over what is happening to them and about them, and to give them the information that they need to make those choices. And of course, this isn't just going to happen magically in an equitable way to everybody. We know that lots of people are excluded, they lack trust in the system, they won't come forward. This has to be one of those instances where that mission for health equity comes to the fore. I talked about collaborative and integrated care. As I said, we really do think this is a test case for integrated care systems. If they can't do this, then you might question what they're for. But I think they can do this, and I think they will. We need to think about training, not just about spotting the early signs, but also managing people, making sure they get onto those treatment pathways as soon as possible, and preparing for those. We are going to potentially have hundreds of thousands of people who are going to benefit from disease-modifying therapies. We probably haven't had anything like this in the health system before in terms of that wave of therapies coming through. How are we going to pay for them? How are we going to finance that? Bearing in mind, these are going to provide incredible value, but they are going to stress the cash flow of the NHS. We need to find new ways of financing that. And we need to find new ways of using technology, as I said, to think about every part of how dementia care is delivered, to make sure we have responsible use of AI. And then finally, we need to think about how all that data is captured, as we've been discussing, to make sure that we have the best sense of what is going on, what clinical trials are happening, what care options are there. And so hopefully what you will find in the report is a strategy. It isn't yet a plan. Ben keeps telling me to make that very clear. The plan is coming next year, first 6 months of next year, where we're going to go into a series of activities, sprints and other activities to turn what are headline ideas into what I hope are crunchy policy, implementable policies that can be taken up by the government, by all the parties, and which I hope they're all going to compete furiously over in their manifestos in 2024, so that if there's one winner from that election that we can guarantee, it is going to be dementia patient.
Thank you very much. I'm Shadow Health Minister and Health and Social Care Minister in the Lords, but I focus on social care in particular. And I very much welcome today's launch, and I'm very pleased to be speaking alongside so many who've done so much to support people with dementia, including the importance of improved research and effective diagnosis, treatment and care. I congratulate Lord O'Shaughnessy and the Dementia Commission for their work on today's report, although I haven't actually seen it, I'm afraid, but I'm sure it's very good work. James and I know each other from the House of Lords. We work closely together on a cross-party basis as ministers and opposition, and we usually generally, including dementia actually, don't we? And we usually generally make a lot of progress on that basis. I also thank the dementia champions here for all their hard work and dedication. That's such an important role, and I do thank you. We in Labour, of course, as Ben mentioned, thinking of our dear friend and colleague Baroness Wheeler, who sadly died on Sunday after 6 years of struggling with dementia, and our love and support go out to her husband Neil and her family at this time. She was truly an inspirational person. As a carer myself and as Shadow Lords Minister, I would like to just say my few words today about those living in dementia in the community and being cared for in their homes by their spouses and relatives. In other words, they're mostly unpaid carers. The Minister mentioned reference to this. I want to underline their role. I've met many unpaid carers locally who are daily, 24 hours, looking after their loved ones in various stages of dementia, most of them only with a few hours break a day or a week. The carer role is so often rewarding, but it's also relentless for so many. Their physical and mental health needs are vitally important if the person-centred care for people with dementia that we all want to see is to be achieved. According to Carers UK, 42% of carers want better support from the NHS or health professionals and better recognition from the NHS of their needs as a carer. Carers' mental and physical health is getting worse, and for some, as Carers UK says, it's at rock bottom. I understand the critical role of what the Commission describes as caregivers, and the need for a comprehensive support system for them is fully covered in the report, and I look forward to seeing the report in detail. Local community carer support means including regular assessments of the carer's health needs, as well as for their loved ones, social care help with their loved ones' personal care, regular respite breaks, paid and unpaid leave for those managing to stay in work and employment, and the support from local primary and community care that's so often disjointed and unconnected. My experience as a carer is that it's the carer that often ends up joining up the GP, the local community support, the hospital and the social care, not the organisations themselves, and that's got to be addressed. It's also vitally important to understand the need for support interventions generally, I think Debbie mentioned this, to be more culturally sensitive for the 25,000 people across the UK with dementia and their carers from ethnic minority groups, ensuring access to services reflect a wide range of culture and languages. So, when we're raising awareness, trying to reduce the stigma surrounding dementia and championing recognition of the unique needs, preferences and experience of individuals with dementia, let's also make sure we provide real help and support to their carers too. Thank you.
The benefit of going after lots of people is that they've said lots of what I want to say already. Thank you so much for having us today. I'm Emily Pegg and I'm the Medical Director for the UK and Nordics at Lilly. Lilly is really proud to be a sponsor of the Dementia Commission, and I'm really delighted to be here with the Dementia Pledge Launch. For more than 3 decades, Lilly has been committed to helping people with dementia. We've invested billions of dollars in researching dementia and Alzheimer's disease, with many trials and tribulations along the way. We really remain completely committed to our partnerships with research organisations, with patient societies and groups to really try and help make life better for people living with dementia. This report and the Vision for Dementia Care sets out a really bold ambition. We see that it's very bold, but it is hopefully one that is achievable if we're able to truly shift the way that we deliver dementia care and address it. And we do note, certainly as an organisation, that this really requires us tackling every single element of the dementia pathway as it currently exists, and we see that reflected in the report. I was a doctor before I went into the pharmaceutical industry, and I remember, as many people have alluded to, that frustration that patients have with trying to get a diagnosis, and the real, not just frustration, but quite a lot of distress, and with individuals who have memory and cognitive impairment, having to go to multiple appointments, trying to get an answer for something that has been really often a problem for quite some time by the time they get to that point. And it's incredibly challenging for them and their families. And so timely and accurate diagnosis, we completely agree, should be a reality for all people living with dementia. And we know that for people living with dementia, that makes a big difference to them, because just knowing what the disease is and therefore being able to access the support they need is a really important part of their journey. So we very much feel that with the right national approach and the political will and the support of many people in this room, that together we can make achieve the ambition to build a new paradigm focused on really compassionate, patient-centred and effective dementia care. And I thank you very much for being here, and really encourage you to sign the Dementia Pledge and give your support to the Dementia Commission. Thank you.
If it's any consolation, I didn't know what an APPG was before I joined Parliament either. Thank you all so much for being here. And listen, you've been listening to us talk for long enough, so I don't want to go on for too long. But I'm going to do something that a politician never does, and I'm going to open by talking about myself and why I got into this space. So I became interested in dementia for 3 reasons. One was because before I became an MP, I was an NHS commissioner, and I could see just how much dementia care was costing us as a health service, how disjointed we were with working with our social care partners, and how badly we were letting down patients with dementia across the area that I was a commissioner for, because we didn't have that joined up thinking, we didn't have that joined up plan, and often we worked in our silos and pushed the patient from pillar to post. And I saw that happen far too often, and I didn't think that was right. The second reason I got interested was, as a former councillor, I saw the strain it was putting on our social care budgets, and over 75% of my council's overall budgetary spend was being spent on social care, and a hell of a lot of that money was being spent on patients, again, with dementia. But again, outcomes were not great in our local area, and my council was not performing particularly well. We were not joined up with our NHS partners, and that was another reason that I thought this is something important to get involved with. But finally was a bit of a personal reason, because my grandfather had dementia. And I know from the people in this room, I don't need to tell you that seeing a person and a loved one go through that, you do not recognise that person by the time they get to the end of their life. And it was something that was so cruel. And yet we felt so helpless as a family. Now, my family was brilliant. We pulled together. We did everything we could to look after, provide that unpaid care, and do everything we could to make my grandfather comfortable. But this cruel, cruel illness took the man that we knew years before he actually died. And I know that for so many people, that's a story that they hear far too often in the work that you guys do. So I thought it was important when I became an MP to get involved with the APPG, so ably chaired by Debbie, who has been a fantastic champion on these matters for so many years. And it's been great to see the progress that we have been able to make, bringing this front and centre on the health and social care agenda. But there is still so much work to do, which is why today's report is so incredibly important, but also the work that everyone in this room does is so incredibly important. So I'd just like to leave you with this and reassure you that you do have friends in the building over the road, even though sometimes it might not feel like it. We are determined to continue speaking up for dementia patients here in the UK and do everything we possibly can to join up those services which are often so disjointed, make sure that funding is adequate, work together on a cross-party basis to find long-term solutions to these problems. As Debbie was saying, and as Ben was saying earlier, there are some real exciting advances that we can take advantage of. I'm personally very, very excited about the possibility of AI and genomics to provide person-centered care. That is incredible, the fact that we can read someone's DNA and come up with drugs specifically for that individual. That is so exciting, and that's not that far off. People talk about it as if it's a decade away. It's not. We're living in that moment now. That's so exciting, and I love to see what we can do about that. But we need the public policy to move at the pace that we want to see, and that's our job over the road, and that's what we can help you guys to do. So we're enthusiastic. We're going to make them enthusiastic. But please do take a read of the report. Get on board with the work that needs to be done, and together we truly can make the UK one of the best countries in the world to be a patient living with dementia. Thank you all so much for coming.
Good evening, everyone. It is an absolute pleasure to be here. Thank you, first of all, for the very kind invitation to be in such wonderful surroundings. The first time I've actually been here, and you come through that arch, and you can't hear any traffic. It's absolutely gorgeous. So a fabulous venue, but lovely to be with so many like-minded people who see the important work that we need to do in dementia. I need to hold my hands up. I haven't read the report yet, but I do want to congratulate you on the work, the Commission, Dementia Commission, on their report that they're launching today. I know, having been in a similar situation over the last few weeks, the tensions around that, but also how important it is because of where we are within the UK, but not only in the UK, across the world in terms of the increasing numbers of people who will become affected by dementia, people living with dementia. But I wanted, if I may, we had a lovely briefing from these lovely people here and saying, oh, you can talk about anything, whatever you fancy talking about. And I thought we should really focus on dementia diagnosis, because there's been a lot in the press recently about new therapies coming online, particularly in terms of Alzheimer's disease, so donanemab and lecanemab, new therapies, as I say, which can alleviate the symptoms of dementia for people with Alzheimer's disease. But that is very much dependent on you having an early and accurate diagnosis. So the report that we launched a few weeks ago, and when I say we, it's the APPG on dementia. And I should mention my wonderful co-chair, Angela Browning, who couldn't be with us today, but together we chaired that inquiry. And it goes under the title of Raising the Barriers, and it's particularly looking at, as I say, the inequalities in dementia diagnosis rates. What we found was that, unfortunately, dementia diagnosis hasn't recovered since before the pandemic, which nationally we had a rate of about 68%. It's now currently just under 64%, but there's a massive regional variation. I think the highest is Stoke-on-Trent. I need to find out exactly what Stoke-on-Trent are doing, but they have a diagnosis rate of 80%, and the lowest is 40%, and that's in Southampton in Devon. So we really need to understand what's going on there. But that means the way that these estimates are developed, there's approximately 250,000 people who are living with dementia without an accurate diagnosis and the support that should come with that. But we also found that it wasn't just about where you lived, but it was also in terms of the socioeconomic circumstances you might be living in. So areas of high deprivation, of high poverty, have lower diagnosis rates. You're more likely to be undiagnosed with dementia if you're from an ethnic minority community. So we need to bear in mind those things as well. And rurality is also an issue. Somebody who provided evidence to the committee had lived in London and was getting a superb range of services and support for her mother living with dementia, and then moved to Lincolnshire, and it wasn't quite as she had found in London. So please do have a read of the report that we developed. We came up with a range of recommendations, but if I could just mention a few. First of all, in terms of data, a proposal around a national dementia observatory so that we have an understanding at a national level which we can disaggregate in different areas and have a real understanding of what's going on with dementia. Making sure that each area, each ICS, integrated care system, has a comprehensive dementia strategy as well. And that we work with our public health workforce to develop the evidence base to understand the causal relationships between, as talked about before, poverty and also in terms of rurality and how that relates to dementia prevalence and diagnosis. So I'll leave it at there and I'll let you peruse that report at your leisure. But again, thank you so much, everyone. This is really fantastic. And, the more that we do on dementia, I think that the UK can lead internationally in terms of the developments for the world. Thank you.
And thank you so much for coming along today. I want to say a little bit about why I came onto the commission. I was so pleased that I was invited by Ben, because when I came into the profession as a nurse 43 years ago, the first ward I went to, I saw some appalling treatment, and I thought I wanted to make a difference. I wanted to make so much of a difference to people living with dementia, not just because of that ward experience, but also because of family experience. My grandfather had young onset dementia, so I went through the experience at the age of 8 of seeing my grandfather change substantially, particularly with his behaviours. Then on top of that, I had my in-laws, both of them who were diagnosed with dementia as well. And what I realised is, although I'm very knowledgeable about dementia, or so I thought, I didn't realise just what the effects were of being a family member living with dementia. The 24-hourness of it, the difficulty in getting access to support, the difficulty trying to get a proper diagnosis, the difficulty when somebody goes into an acute ward and people make assumptions about what the person can and cannot do and whether or not they can come home safely. So all of those things have enabled me to be able to fight to make sure, and particularly in my role as the CEO of Dementia UK, to make sure that the families don't have that experience that I've experienced as a family carer. So when the information came through about the commission, it was, yes, of course I will be involved in that. But a part of me was always worrying that it will be a talking shop, because so many of the different things that we get invited to can be a talking shop and they don't actually kind of come to anything in the end. I have to say, I have been very impressed. The workshops that we attended were really well run. The organisation ability, The report, please do read the report. It is absolutely a fantastic piece of work. And actually having the pledge and getting people behind wanting to make a difference to the lived experience of dementia, whether that's for a person that's got the diagnosis or it's for the family. One of the things that I frequently hear, because I still work clinically in my role as well, one of the things I frequently hear from families is the difficulty getting people to get a diagnosis of dementia. And partly that's about getting access to the assessment services and being referred to the assessment services, but partly it's because people that are living with the symptoms often don't want to be going along to the GP to get the diagnosis because there's still a fear, there's still stigma around getting the diagnosis. There's still this thought that as soon as you get a diagnosis, you're going to go into long-term care or someone's going to strip you of your driving licence. We need to change that because until we do, we'll be saying, oh, we're getting 64 or 66% of people with a diagnosis. Would we accept that from any other condition? Of course we wouldn't. We'd be looking towards 90, 100%. And as Debbie quite rightly said, there's such a variation across the UK as to whether or not people will get a diagnosis or even be referred to get a diagnosis. And if we do something about getting rid of this stigma and discrimination, getting away from using the language of sufferer, dementia time bomb, all of these very negative kind of words that people use, I think we'll get a little bit further along, taking people to say, you know what, I've got some early symptoms I'm concerned about. So they would go to their GP, they would go to get the assessment. And let's face it, some of those fears that a person may have might not be dementia at all. It might be a treatable condition. And once you get the diagnosis, I absolutely agree. It's about getting the diagnosis timely. It's also about getting an accurate diagnosis. My specialism is for young onset dementia. And when you come across families living with young onset dementia, often they've been given 4 or 5 diagnoses before they ever get the correct diagnosis. That means 4 or 5 years, usually, waiting to get the correct diagnosis and therefore to get the support that you need for a family and for the person that's living with the diagnosis. And that was brilliant about this commission because people actually listened to that, and that was a part of what we discussed in some of those groups. And so frequently, underserved communities are forgotten about, whether that's from an ethnic minority group or whether that's from young onset or whether it's from some other specialist position. So please, please pledge to support dementia care, because I think it is so important. Like I say, it's my passion. It's been my passion for 43 years. And hopefully some of you as well have got a passion for that. And I would guess that in this audience, probably about 3/4 of the people will have family experience too. So you know how important it is to make sure that dementia care and the people living with dementia are actually supported adequately. So thank you very much.